So let's talk about HPV today. HPV is the human papillomavirus. Do you know that HPV is one of the commonest sexually transmitted infections? Yeah, when I say sexually transmitted, you can get HPV with oral sex, with vaginal or anal sex. And remember, even if you had sex with one partner, you can still be exposed to HPV because a lot of time HPV stays dormant or there are no signs and symptoms for years and years. The only way you find out HPV is positive is because you had a positive test, and that can take years before the test comes positive. So HPV can be very silent. Depends upon what type of an HPV. And when I talk about the types of HPV, there are several different types of HPVs out there. I would say there are over 40 different subtypes of HPV available. And what we do is that we divide the HPV into low risk and a high risk. What is the risk for? Risk for cancer. So high risk HPV can increase your risk of vaginal, vulvar, cervical, oral, as well as anal cancer. The low risk HPV, however, can cause genital warts. So just because you have warts does not mean you're gonna get a cancer, okay? Because though they are HPV viruses, there are two different subtypes of them. So it's really important that you prevent getting an HPV in your life. The HPV, as I said, is such a silent, not silent killer is the right word I would say, but the silent infection out there. So how do you prevent HPV? Two ways of preventing it. One, have a protected sex. Unprotected sex increases your risk of getting HPV, and it's very common. 60% of the time you could end up getting it if you had unprotected sex. Like condom is not 100% protection though, right? So what is the other way is getting HPV immunization or a vaccine which is out there. Now this vaccine has been available for a long time now. It has been studied in hundreds of patients and is very, very safe. It's very effective. 97% efficiency rate once you get the HPV vaccine. Now, I told you there are 40 different kinds of HPVs out there, but the vaccine which is available does not cover you against all these different variants. It covers you against about 9 of them, but these are the 9 bad viruses which have been associated with cancer. So just because you have a vaccine does not mean that you can't have unprotected sex. You still need to use protection to protect against different subtypes you haven't been covered with. Now the vaccine, you can get it anywhere. Your pediatrician's office, your family doctors, gynecologist, or even the health office which is out there. Even Planned Parenthood, I think, has HPV vaccine available. It is covered by all insurances, so don't worry about it. It is not gonna cost you anything. Now, who can get it? It is available for kids starting at age 11 to 12. Really important to get the HPV vaccine before you are sexually active, because then it's gonna give you the best prevention before you are even exposed to any kind of HPV. But just because you have been sexually active doesn't mean you can get it, because it's available for women up to age 46, depending on their risk factors. So you can definitely talk to your gynecologist or your family doctor about getting the vaccine, even if you are sexually active. Now, once you are sexually active, I told you have a high risk of being exposed to HPV. And for some reason, if you already been exposed to it, can you still get the vaccine? Yeah, you can, because it is going to protect you against the other HPV viruses you haven't been exposed to in your life. So for sure, go ahead and get it. And remember, it is also available for boys and men starting at age 11 and it is available to, I told you, up to the age 46 right now. Now, if you are pregnant, should you get HPV vaccine? No, it is not recommended during pregnancy. So wait after pregnancy and then get the vaccine. Okay, now if you already have an HPV, or if you already have a genital wart or a precancerous cells on your cervix, can you still get an HPV virus? Yes, because the likelihood that you haven't been exposed to all the viruses the vaccine covers. Okay, so it's not a treatment. It is not gonna treat you against what you already have, but it is gonna prevent you from getting other kind of HPV you haven't been exposed to so far in your life. So there are 3 shots. You need to get them within 6 months time, and the side effects very minimal. All we have seen so far is some redness and pain at the site of injection, some nausea, and some dizziness. That's about it. Otherwise, it's very, very safe. So really important that prevention is what we really have to concentrate on when we talk about HPV. Cervical cancer is a preventable disease, and it can be prevented by getting the vaccine and using condoms or some kind of a protection. So definitely talk to your gynecologist next time you see them.